Welcome to Innovative Care, where we combine science and technology to deliver the most current and evidence-based care. My name is Dr. Jeanne. I am a board-certified nurse practitioner in family health and aesthetic, as well as a certified medical examiner. Today, we're diving into a crucial topic: how to best prepare for your DOT or CDL exam. This exam is really important. It's a vital step in ensuring your safety and the safety of others on the road. The Federal Motor Carrier Safety Administration, FMCSA, has established a series of regulations that serve as standard requirements that must be followed. As your certified medical examiner, my role is to make sure that all drivers meet the necessary standards for safe operation. Let's talk about the key areas we'll evaluate during your exam. Physical requirements. You must have no loss of a foot, a leg, a hand, or an arm, or you must have been granted a skill performance evaluation certificate from FMCSA. Diabetes. If you suffer from type 1 or type 2 diabetes, you must show clearance from your primary care provider that your blood sugar is controlled either by oral medication or insulin. Heart and cardiovascular health. You must have no current clinical diagnosis of heart attack, chest pain, coronary insufficiency, blood clot, or any other vascular disease that can cause fainting, shortness of breath, collapse, or congestive heart failure. Breathing and respiratory health. You must have no established medical history or clinical diagnosis of a breathing problem that is likely to interfere with your ability to control and drive a commercial motor vehicle safely. Blood pressure. You must have no current clinical diagnosis of high blood pressure that is likely to interfere with your ability to operate a commercial motor vehicle safely. You can also provide us with evidence that you've been taken care of by a PCP in trying to manage your blood pressure. Muscles, bone, and movement. You must have no established medical history of clinical diagnosis of arthritis, orthopedic muscular, neuromuscular, or blood vessel disease that can interfere with your ability to control and operate a commercial motor vehicle safely. Seizure disorder. You must have no established medical history or clinical diagnosis of epilepsy or any other condition that is likely to cause loss of your ability to control a commercial motor vehicle. Mental health. You must have no mental health, nervous, organic, or functional disease or psychiatric disorder likely to interfere with your ability to drive a commercial motor vehicle safely. Vision requirement. On a Snellen chart, you must have distant visual acuity of at least 20/40 in each eye without corrective lenses, or visual acuity separately corrected to 20/40 or better with corrective lenses, and distance two eyes vision of at least 20/40 in both eyes with or without corrective lenses. Your horizontal vision in both eyes should be at least 70 degrees, And you must have the ability to recognize the color of traffic signals and devices showing standard green, red, and amber. Hearing requirement. You must first perceive a forced whisper voice in the better ear at no less than 5 feet with or without a hearing aid. If tested by hearing equipment, you must not have an average hearing loss in the better ear greater than 40 decibel at 500, 1,000, and 2,000 hertz with or without a hearing aid. Substance use requirement. The FMCSA has strict rules about controlled substances for commercial drivers. Schedule 1 drugs such as marijuana or cannabis, including medical marijuana and PCP, have no federal exception. Schedule 2 drugs such as amphetamine, narcotic, and other habit-forming drugs are only allowed when the use is prescribed by a licensed medical practitioner who understands the duty and demands of a commercial motor vehicle driver. Alcohol. You must have no current clinical diagnosis of alcoholism. The purpose of this video is not to alarm you, but to help you understand the importance of taking care of yourself and your health to meet the demand of such an important job. When you come to see us for your physical exam, please bring your driver's license, your previous certificate if you had one, a letter from your primary care doctor informing us about your health condition, and also a clearance to operate as a driver and any exemption you may have from FMCSA. We are located at 1712 Nostrand Avenue, Brooklyn, New York, 11226, between Cortelyou and Clarendon Road. You can take the 44 bus or the number 2 and 5 train, or we'll stop on Beverly Road, and we are just a short block away from the train station. Our phone number is 347-240-7588. For more information, contact us or visit the FMCSA website. Remember, self-care is not a luxury, but a necessity. Let's all take care of ourselves and each other. Thank you. See you soon. Bye.